Preparedness is a multifactorial process, and it really is not exclusive to a particular industry. Obviously, within the healthcare system, it's very important to us, but it's a all disciplines approach to mitigating or managing truthfully, any emergency, whether it be a blackout within the hospital, whether it be a mass casualty incident with multiple patients coming to us, whether it be a prolonged event such as flu season or an infectious illness outbreak. So it involves pre-planning, it involves financing of the event, it involves training the staff for this all hazards approach. It involves managing the patients, whether they be through the emergency department or as inpatients, and then recovering from that influx or from that event and preparing for the next event. This is something that all hospitals are required to do through the Joint Commission as a part of their accreditation process. The extent by which they participate is truthfully up to the hospital in terms of how they train their staff, but all hospitals are required to participate in the process. Under the Affordable Care Act, there is certainly great debate whether there are changes in volume. I can tell you the emergency department that I work in, year to date, under the Affordable Care Act, we are approximately 6 to 7% ahead of volume from last year. Part of that is related to what was a pretty serious flu season, but under the Affordable Care Act, there are more people with insurance. The unfortunate part of the Affordable Care Act is there are less people despite insurance, with less access to physicians. And after all else is said and done, hospitals and emergency departments are still viewed as the safety net for all comers. And so people utilize us regardless. I wouldn't use the word primary care issues. They are having what I would refer to as episodic care. So they have an acute issue, whether it be bronchitis, whether it be a pneumonia, something that could potentially be managed by a primary care physician, or at least on the first go-around, and evaluated by a primary care physician. But they're having an acute event, in their view, that requires them to see a physician within 24 hours, within 12 hours. Does it necessarily require lots of blood work and invasive scanning, et cetera? Probably not, but in their view, they are required to see a physician in a short period of time.